Welcome to today's press briefing in relation to COVID-19 epidemic. We have with us Professor Chung-mau, Secretary for Health, Mr. Christian, Secretary for Labour and Welfare, Dr. Edwin Choi, Controller of the Centre for Health Protection of the DOH, and also Dr. Tony Ko, Chief Executive of the Hospital Authority. They will speak in turn, and then the floor will be open for questions. Professor Lo will have the floor. Hong Kong citizens, friends of the media, Hong Kong has experienced 3 years of COVID-19 epidemic, and with mutation of the virus and the emergence of Omicron as the mainstream variant, we have enhanced the resilience of the local healthcare system as well as the overall resilience of our society in tackling the epidemic. There have been significant changes in the risk of COVID-19 posed on our public health care. Having considered the above, the Chief Executive already announced at today's Chief Executive Questions and Answers session that starting the 30th of January, Monday, the government will remove the arrangements of issuing isolation orders for those infected with COVID-19 in accordance with CAP 599A, Prevention and Control of Diseases Regulation. And on this occasion, together with the Secretary for Labour and Welfare, Chief Executive of the Hospital Authority and Controller of the CHP, give you more details in relation to this arrangements. As you can see in this chart, it shows that the emergence of the Omicron variant has led to the fifth wave in 2022. And what happens since then? The blue line shows the number of infections, and the red line shows the viral load as detected in our sewage surveillance work. Now, as you can see on this chart, the viral load detected in our sewage surveillance is in line with the infections recorded. In other words, the surveillance has helped us obtain useful data engaging the development of the epidemic. And since the beginning of last year, in 2022, with emergence of the Omicron variant, we have witnessed two peaks. The peak in early 2022 came rather rapidly, and then there's been another peak towards the end of 2022. And as you can see, it's not as sharp as the previous peak. And if you compare the number of infections and the viral load detected through surveillance of sewage, you will see that these two trends are similar. In other words, we have experienced a high level of infections in the community. In the end of December, we recorded close to 30,000 infections, but as of the 18th of January this year, we only recorded 3,000 plus cases. So that shows we have passed another peak. And since July, in light of the increasing trend, the government took steady steps to adjust our anti-epidemic measures. For example, we gradually adjusted and relaxed the testing and quarantine arrangements for inbound travelers. We ultimately scrapped the arrangements altogether, sparing them the need to be tested and quarantined. We also relaxed social distancing measures. Now, if we compare the two peaks brought about by Omicron, one in early 2022 and the other in the end of 2022, you will see some marked differences. In terms of fatality, in early 2022, the fatality rate was as high as 0.77. We just passed another peak in the end of 2022, and the fatality rate was then just 0.19. As for service adjustments of the hospital authority, again, we see a significant improvement. In early 2022, service capacity was reduced by close to 60%, which had a significant bearing on our patients. And then if we look at the peak that we've just passed in the end of 2022, only 10% of the capacity was affected. So that shows the overall capacity of the public healthcare system has been enhanced. So in other words, we have built up our capacity in the following 3 areas, such that even in the face of an epidemic peak, we could still weather the storm. The first enhancement is that we have better immunity. The vaccination program helps boost the overall inoculation rate. For the vaccine coverage for 2 and 3 doses, we have reached 93 and 84% respectively. Together with the immunity developed after many people have been infected with Omicron in the 5th wave, the effective 3-dose inoculation rate is now 95% or so. So overall speaking, we have quite good hybrid immunity to shield us against COVID. And for those who have completed the vaccine regime, most of them only exhibit mild symptoms even after they've been infected with Omicron. The other point is in terms of the resilience of the overall healthcare system. With effective responsive plans drawn up by public hospitals and support from private hospitals, telemedicine services, and extensive use of COVID antiviral drugs, the overall resilience of the healthcare system has also been enhanced. The third area is that as far as the whole society is concerned, again, members of the public, organizations are now better equipped with the knowledge and experience relating to COVID. And I'd like to highlight residential care homes as one of the parties which have also enhanced their capacity in handling and preventing infections. In order to continue on a path of return to normalcy, the government will be adopting a new mode in fighting the epidemic. Instead of having across-the-board mandatory isolation, we will adopt a voluntary mode. Starting on the 30th of January, the government will scrap the mandatory isolation arrangements. Instead of issuing mandatory isolation orders, the government will be giving health advice to members of the public. So, in other words, the Department of Health will not be issuing isolation orders for the infected, and they will no longer be required to observe isolation in their homes, hospitals, or isolation facilities. And starting on this day, those who test positive will no longer be required to declare their status on the CHP's online platform. But I need to emphasize that it doesn't mean that we have eradicated the COVID-19 virus. The virus continues to pose a threat to the young and the old in our community and the vulnerable groups. And together with uncertainties in the global pandemic situation, we will maintain the level of emergency relating to COVID until further notice. On the other hand, we will also act in accordance with the World Health Organization's advice in monitoring the COVID-19 situation, including the data collected from sewage surveillance and also genetic analysis of the specimen taken from inpatients, so as to make regular reportings to the World Health Organization. We will also continue with the anti-epidemic measures in care homes, schools, and public and hospitals. For example, testing requirements involving staff, students, and visitors, and make suitable review and adjustments in line of the latest development and the level of immunity in the community. I will now invite Dr. Edwin Choi to brief you on the details of the removal of isolation orders.
Thank you, Secretary. Friends of the media, fellow citizens, let me brief you on 3 arrangements. The first one is the removal of isolation arrangement, and second, the short-term operation of the holding center and the other centers, and also the reporting of the COVID cases and the dissemination of information. First, about the removal of the isolation. As the Secretary said, starting from the 30th of January, we will not be issuing any more isolation orders. And the isolation orders issued will be rescinded. And the COVID positive people don't have to make the declaration online. Instead, we'll be issuing general health advice, and we will stop delivering the kits to the positive patients. Now, on the 30th of January, the isolation order will be removed, and those with isolation order will be notified of the removal. If people are still in the isolation facilities, they will be arranged to leave in an orderly fashion. There are 3 tools that will be stopped. RATP declaration platform. Second, the platform for declaring PCR positive cases. And third, the telephone declaration system. All these 3 tools will cease to be in operation. For the COVID positive cases, we will be issuing the health advice. Like for these people, they have to take measures to guard against respiratory diseases. They have to observe personal hygiene, and they have to avoid contact with people at home who are not wearing masks. They should open the windows for better ventilation and disinfect the home. For the first 5 days after infection, they should wear KF94 and KN95 or other measures, and they should avoid getting in touch with high-risk people or dining with people who are in high risk. And they should avoid going to crowded places or attending large gatherings. For the positive people without symptoms, they can go out and they can turn up for work. We'd like to protect the younger groups of people. Students are testing positive should avoid going to school until they test negative. For other people, they have to pay attention to their health condition, particularly the high-risk people or those with symptoms. When the symptoms get worse, they should seek medical attention straight away. For those who need sick note, they need to go to the practitioners or TCM for medical attention. This is no different from many other respiratory diseases. For those with symptoms, they should avoid going out. They should stay at home. Second, about the community isolation facilities. Back in October, on a daily basis, about 1,400 to 1,500 people were admitted to these facilities. Over the past couple of days, on average, we have 150 who request admission to these centers. The number has come right down. For some positive patients, they may be living in cramped condition at home, and they would like to stay in the isolation facilities to avoid any transmission. So the facilities will stay open for some time. In this transitional period, we will allow Hong Kong people to use these facilities. For those who need these facilities, they can get in touch with the FSD on the hotline for delivery. We have 24-hour 5233-2939. And for those who get admitted to these facilities, there will be an RAT test performed on them. It's only when they test positive that they will be admitted. They can stay as long as 7 days. If the home condition permits, they can choose to leave early without having to wait until a negative test result. After they have left the facilities, they cannot go back, so they cannot be going in and out of these facilities on a daily basis. For the holding centers, the residents who test positive, there will be no difference. For those with 3 jabs, they can go to the holding center for care. For those who display more severe symptoms, there will be an assessment of the health condition, and where necessary, they will be sent to hospital for treatment. Now, for the CIF and the holding centers, the transitional arrangement will stay until the 28th of February. Third, about the declaration arrangement. COVID-19 is a statutory declarable notifiable disease under PCDO, and it will be only requiring the declaration of serious and death cases. The CHP will be announcing the PCR positive cases and death cases instead of having press releases. For other statistics, we will be releasing the information on a weekly basis. We will be monitoring the COVID-19 from different angles, like the serious and death cases and the sewage surveillance. We will maintain our system where we will be testing the mutant strain for positive cases. We will be monitoring the outbreaks in schools and care homes, and we will be putting the COVID-19 into Sentinel monitoring system, and we will be soliciting the consultation information from the doctors. It will be no different from the monitoring of seasonal flu and like the respiratory endemic diseases. Mr. Tony Cole.
Good afternoon. Let me now say a few words on the new arrangements with the removal of the isolation order and the support provided by hospital authority to those infected with COVID in the community. Secretary and Dr. Choi already explained just now that there are signs of the epidemic ebbing with a reduction in the number of confirmed cases. So in light of the latest situation, we're going to implement the following arrangements. We're going to enhance GOPC services, general outpatient clinics. With a drop in the number of people infected with COVID, we need to look after infected patients as well as other patients who have been affected because of adjustments to our services earlier. Now we are going to provide treatment services for COVID positive patients in GOPC, and earlier some hospital beds were set aside especially for COVID positive patients. Now we will revert to the original arrangements to receive other non-COVID patients. And at the peak of the epidemic, we deployed manpower and other resources to look after COVID patients. Now we will resume services in other aspects, such as bookings for surgeries. After scrapping the isolation order, we are going to enhance GOPC services. For example, as you know, infected persons at the moment are required to visit the 7 designated COVID-19 clinics. They will be subject to assessments, and if deemed suitable, they will be prescribed COVID-19 antiviral drugs. Starting on the 30th of January, instead of providing the service through the 7 designated clinics, we are going to provide this service through all 70 GOPCs. In other words, prescriptions for COVID-19 antiviral drugs would be available in all 70 GOPCs, and subject to doctor's assessment, if deemed suitable, patients will be given antiviral medication. As for clinics currently or previously suspended, their operations will resume as well. We earlier, for example, suspended services at night time and on weekends, and we will resume these services. In order to ensure that COVID-positive patients and other episodic disease patients can receive adequate care, we will increase the quotas at the GOPCs from 7,500 to 10,000 plus. At the moment, there are about 700 confirmed cases visiting our clinics daily, and they are of a higher risk group, and sufficient quotas will be reserved so that we have consultation sessions to look after the young and old and other high-risk groups. So if need be, we will make sure that consultation slots will be available at the GOPCs so that they receive suitable care. As I mentioned, extra slots will be available for the elderly, children under the age of 5, expectant mothers over 28 weeks of pregnancy, and those immunocompromised adults. And if you want to make a booking, you can do so in the following 3 ways. For example, you can use the HA Go mobile app to make a booking for a GOPC session or for telehealth service. This app will in future include a function for COVID-positive patients to make bookings through the 70 GOPCs, and special quotas will be set aside to give them priority. We also have special quotas for the elderly. And as I explained just now, service quotas will be increased so that those coming down with COVID will be able to consult us if necessary. And we'll also enhance our support hotline, that is 1-833-6115, to make sure that help is provided for those encountering difficulties in booking a session with us. They can just ring this hotline. As for other patients, the younger ones, the asymptomatic ones, the ones without high risk factors, again, they can make a booking with us using HA Go or the telephone appointment booking system. They can also approach us by calling the hotline 1-833-6115 for inquiries and assistance. We'll also enhance manpower to make sure that adequate support is provided. But we must also bear in mind that quotas should be reserved for high-risk patients. For those patients without severe symptoms, in practice, many patients with mild symptoms will be visiting private clinics, such as those coming down with common colds or flu. As for teleconsultation service, we are going to suspend the service because of isolation orders. The confirmed cases found it difficult to seek medical attention. But with the isolation order being scrapped, patients can now seek medical help on their own, and we can also focus our manpower on providing consultation services at the GOPCs. We are able to provide extra quotas because after suspending telehealth services, we can redeploy manpower to support GOPCs, and this will also help our doctors in their clinical assessment and checking the patient's history, and also for doctors to look after non-COVID patients as well. We understand that further explanation may be needed, so we will enhance our hotline 1-836-115 to help the public. And the other focus of our service is outreach medical teams. We'll continue to deploy outreach teams to support elderly residents in residential care homes. As for other service arrangements, such as hospital beds, we've seen a marked decrease in the number of COVID patients admitted to hospitals. So through flexible deployment of beds, some of these hospital beds originally reserved for COVID patients will be released to take other patients. And after the Chinese New Year holidays, we plan to resume other services, for example, to allow pre-booked surgeries and other services. The Chinese medicine services will also continue to provide support to rehabilitating patients. As we resume normalcy, inpatients will be required to pay the fees as scheduled. That's for eligible persons. For non-eligible persons, again, they are required to pay the fees and charges applicable to non-eligible persons, and they will need to pay extra for COVID antiviral drugs. Thank you, Dr. Ko.
I'd like to call upon Mr. Chris Sun, Secretary for Labour and Welfare. On the 30th of January, there will be no more isolation order to be issued. I'm sure the members of the public would be most concerned about the sick leave arrangement. And I also like to take this opportunity to say a little bit about the duty arrangement for the care home staff. First of all, sick leave arrangement. We have amended the employment ordinance in the middle part of last year. Those subject to isolation order will, under the employment ordinance, be entitled to paid sick leave. So there are two conditions. First, under the continuous contract of employment, one is employed under this. Second, the sick leave is more than 4 days. As of the 30th of January, the health authorities will not be issuing isolation orders. From then on, if one is infected with COVID-19, then under the employment ordinance, the sickness arrangement will be no different from any other diseases. Now, those who come down with COVID will go to the doctor for medical attention, and the doctor may issue the sick note. And if one needs 4 days or more of sick leave, then under the EO, the employer will have to pay for the sick leave. So starting from the 30th of January, employees infected with COVID will not be any different from any other diseases for which they have to seek medical attention. So this is the arrangement for sick leave. Second, about the RCHD and RCHE staff duty arrangement. As we understand, as the measures are moving into a new stage, we are moving towards normality. However, we have to protect the vulnerable elderly people in the care homes. Those working in the care homes will, at the moment, need to undergo PCR tests 48 hours ahead of work, and also the RAT test. And this arrangement will continue for the protection of senior citizens. Starting from the 30th of January, if a staff member is infected, or if a staff member tests positive under a PCR or AT, then the staff member should not turn up for work, and the care home should not require them to be turning up for duty. The idea is to protect the senior citizens and also to minimize the transmission risk in the care homes. We fully appreciate that in absence of the sick staff, they need to have relief staff. And we should be able to manage this because we have been distributing the special allowance for manpower support to the care homes in Hong Kong, and they can make application on a reimbursable basis. If the COVID-positive staff members have to take sick leave and relief staff will be required, and under this special allowance, the government will be picking up the tabs. So once again, I'd like to urge the care homes operators that the COVID-positive staff members are not supposed to turn up for work. And this will continue until further notice. The whole idea is to properly protect the vulnerable senior citizens in the care homes. So much from me for now. I now throw the floor open for questions. Please speak into the microphone and also identify the organizations you represent. Please restrict yourself to 2 questions and make it brief, please. Gentlemen in long sleeves. AM 730. You mentioned the asymptomatic positive people, if they don't want to turn up for work, in order to avoid transmission, how would they be able to get the sick leave? And also students advised not to turn up for school. If they don't go to the doctor, how can they show that they are sick without affecting their attendance and also their pay? Now it is said that this is not a kind of a flu. Have you changed your mind about this COVID disease? Right. Your question is twofold. First, under normal circumstances, if one tests positive, there will not be any isolation order. If one feels if one doesn't feel unwell, one can turn up for work. Of course, there should be proper hygiene to be observed. As to whether there is any agreement with the employer, certainly there can be such an agreement. If one doesn't feel unwell, one can turn up for work, and the employer should allow them to do so. If there is an agreement that the employer stops him going to work, then there's another matter. If the employer disallows him from going to work, the employer has to pay for the staff member. As to the care homes, this is a special arrangement because we like to protect the vulnerable people in the care homes. If a staff member in the care home is infected, doesn't matter whether it is serious or not, we would advise them not to turn up for work. And the care homes will need relief staff. Then under the special allowance for manpower support, that this issue can be addressed, so there will not be any extra expenditure because the government will pick up the expenses. This will effectively protect the vulnerable people in the care homes. Dr. Low, Professor Low, we've heard this on many occasions, and there have been a lot of discussions. Without a doubt, COVID-19 shares some similarities to flu. It is a kind of a respiratory infection, and there are indeed similarities in terms of measures like face mask, isolation, and vaccines. Now, COVID-19 is not flu. There are a lot of dissimilarities. For COVID-19, it is not the same as flu. The symptoms are also different. The transmissibility is so much higher than flu, and the vaccines are also different. The way of treatment is also different. So I'd like to emphasize that COVID-19 is another respiratory infection. If you say that COVID-19 is flu and let down our guard, then I think we have to tread more carefully here. If you equate the two, then people would get the misconception that they are the same disease, and the treatment, indeed, the treatment would be different. COVID and flu added together would aggravate the situation. So it's not the case that the two put together would be the same as coming down with flu. It can be more serious than just taken ill with COVID or flu. And if we suffer from a twindemic, then it would be really disastrous to society and also to the healthcare system. So we cannot look upon COVID as a kind of flu, and 1 + 1 can be more than 2. Next, please. The gentleman in green and on the third row. Now TV. In terms of sick note, now will there be any guidelines to be issued to the doctors if one doesn't have any symptoms and one would like to take sick leave? Is this possible, or is it down to the clinical judgment of the doctors? Is it going to be 5 days or what? That the COVID positive patients can move in and out of the GOPCs. Now we have so many senior citizens and children. Aren't you worried about the cross-infection?
Dr. Choi will reply to the question on sick leave certificates to be issued by doctors, and then Professor Low can take the question on GOPCs with young and old patients. I think you're concerned with asymptomatic patients and whether sick leave certificates should be issued to reduce the risk of transmission. We've moved on to another stage of the epidemic. Time is ripe for us to treat COVID as another kind of respiratory disease. This is how we resume normality. So if you suffer from a respiratory disease, and if you do not have symptoms, it's for the doctor to decide whether a sick leave certificate should be issued. Now, just now we talked about special groups such as residential care homes where there are frequent contacts between staff members and residents, then special treatment is warranted. However, in general, it's for the doctors to pass clinical judgments. The doctor will assess the patient's physical condition to see if the patient should be issued sick leave certificate and rest at home until recovery. Dr. Ko will take the other question. As mentioned by Dr. Choi, we are now treating COVID quite akin to the other diseases. And apart from taking care of COVID patients, we also need to take care of non-COVID patients. It is therefore essential to flexibly deploy resources. Unlike what happened in the beginning of the epidemic, we no longer send confirmed patients to the highest level of isolation wards. Instead, we implement suitable infection prevention and control measures. Like Dr. Choi said, preventive measures should also be adopted. We should observe hand hygiene and wear a mask to reduce infection transmission. So in future, I reckon that we will be taking care of COVID patients like other patients suffering from respiratory diseases. Say, for patients who have coughs and runny nose, we will adopt suitable measures. We will require that masks be worn and hand hygiene be observed, and if possible, the patient should be separated from other patients. This is the current situation in the A&E unit, and it is also possible in other wards that we adopt the measures I mentioned. This reporter in a green jacket. Good afternoon. I'm from Economic Times. First, Mr. Sun, in relation to paid sick leave, say if we allow high-risk infected people to go to work to be mixed with colleagues not yet infected, how are you going to handle situations where they would rather stay home instead of risking infecting others? And also, for residential care homes with infected residents, do they need to make a report? And after the 28th of February, when holding centers are no longer in operation, then how should the care home operators deal with a surge in the number of infections in their homes? I think you've asked 3 questions. Please wait until Secretary Sun has answered your questions. As I explained, starting on the 30th of January, with cancellation of isolation orders, employees coming down with COVID should be handled in the same way as other situations as far as sick leave is concerned. Now, if the employee feels unwell, he can approach a doctor, and according to the doctor's assessment, if necessary, a sick leave certificate can be issued. According to the employment ordinance, if the sick leave number of sick leave days granted is more than 4 days, then the employer is required to make sick leave payments to the employee. Now, previously, because of the isolation order, the patient is not allowed to leave home, and now the positive patients can seek medical attention on their own. So that's how we address the concern. About the second question about holding center arrangements, at the moment, the majority of cases are handled on site, and Dr. Choi just now explained that the transitional arrangements. There may still be a small number of elderly residents requiring hospital admission, and they will be sent to hospital. As for others, we will keep in view the situation. If we find the need to restart the operation of holding centers, we will do so. At the moment, as you know, holding centers or holding facilities are set up in sports centers, and we have this experience. Depending on the demand, we may commission certain sports centers as holding facilities again. That is subject to assessment. The transitional period will go from now to the 4th of March, and we will consider the demand. Next question. This lady in the white jacket.
MP, Professor Low, is the government calling COVID an endemic now? How could the elderly and children living in the community be protected if COVID positives are not imposed any movement restrictions? And the second question, is there still a definition on whether a patient has recovered from COVID after isolation arrangement is lifted? What if disputes arise when doctor's clinical assessment does not match patients' expectation on the number of sick leave days they get? And would the authorities issue any guidelines on that? Thank you.
Professor Low, please.
The term endemic is a public health terminology. In fact, it refers to the fact that a disease is continuously spreading in the local environment. But in fact, COVID has been declared as a pandemic. It's actually affecting the whole world. It's a global disease. So we can, of course, say that the disease is endemic in Hong Kong. The fact that it has been spreading in our community, and we are now changing our strategy. But I don't think we should just, because of the term endemic, regard this disease of lesser significance. The fact that it's still spreading in our community, and the fact that it is affecting our high-risk group, such as the elderly and our young kids, and also the fact that it's affecting our healthcare system, means that we have to continue our fight against this disease, not in the sense of using social distancing measure or isolation order, but with effective vaccine, with our personal health, hygiene measures, and also with effective treatment. So I'd like to remind the public that we still have to treat this disease as an issue of public health importance. Regarding the definition of recovery, I think now that we are lifting the isolation order, then this disease will be treated as any kind of respiratory tract infection by our healthcare professionals. And they will use clinical criteria to define which patient has recovered and which patient requires treatment or continuation of other measures. So this is a clinical decision, and we will leave it to the professional.
Next question. This lady in a black jacket. I'm from Tsingtao. Good afternoon. Secretary, you mentioned that the requirement for residential care home staff to be tested by PCR within 48 hours of going to work will be in place. Now there are queues for PCR at PCR stations. Are there measures to help them? And when are you going to scrap the mask mandate?
We will maintain the 48-hour PCR test and the daily RAT test arrangement. The PCR test, they can have the contractor coming for collection, or they can turn up at the testing center for the tests. If it is inconvenient for them to go to the testing center, so they can have the contractor coming along to collect the samples. And this is to facilitate the collection of PCR samples. As to face masks, I can tell you that in my day-to-day life, I don't really want to wear face masks. Although I am a doctor myself, I'm so used to wearing face masks in a hospital setting. But we have to bear in mind that in the midst of COVID pandemic, face masks played a significant role. This has avoided a lot of infection or even deaths. Starting from July last year, this term of administration has embarked on a steady, progressive arrangement to adjust the anti-pandemic measures. most of the social distancing measures have been lifted. And for the inbound travelers testing arrangement, we have also made huge adjustments. And this culminated in the opening of the boundary, and all these are intended to put Hong Kong on the path to normality. We stuck with the face mask for 3 years. There should come a day when we can ditch the face masks and we can see your smiles. We are moving in this direction. But I hope that the members of the public would bear in mind that the face masks would be instrumental to preventing infection. Now, the winter season is still with us. The peak the peak is behind us this month, but the key thing is still the face mask. So our view is that during this winter, we should still insist on the face mask. At the right time, we will consider under what circumstances we will adjust the face mask mandate, and ultimately we will do something about it. But I have to stress, I can't stress enough that the face masks can help the members of the public. Even if we lift the face mask mandate, I'm sure that a lot of the members of the public would voluntarily keep the face mask on, in particular when the respiratory diseases are circulating. The face mask will certainly help. Let's take 2 more questions. The 4th row, a lady in blue jacket, please.
TMHK, why the government think it's appropriate to drop the isolation order? Is it to align with mainland's COVID policies? And the second question is, as COVID patients without symptoms or with mild symptoms can still go to work without a sick note, could it bring any risks? Also, how to hold people responsible if they're not self-disciplined after being infected? Are there any consequences? And if there are no consequences, how to protect the vulnerable groups? Thanks.
Professor Low, please.
The adjustment of isolation order is after due consideration of our local situation. Because every country and every region, city, will have to decide on its own local anti-COVID strategy. And I've already mentioned the reason is all related to our higher immunity barrier, the fact that our healthcare system is much more prepared, and even our whole community and our citizens have actually better knowledge and ability to handle the infection. The disease is now milder to the fact that we don't think an isolation order is warranted. And of course, this is a shift from the past 3 years when the responsibility and even the authority for issuing an isolation order rests with the government, and it's a sort of mandatory requirement under the law. We're now shifting the decision to how to deal with this disease to our citizens, so they can decide how to handle this as in any other respiratory tract infection. Regarding the risks of going to work, of course there is a balance of the risk and benefit. So we are actually balancing the risk of infection versus the resistance of such isolation order and the burden of such isolation order on our citizens' activities and also in our economic activities. So this is obviously a balance. But we are not saying that these patients who are infected, who test positive, would go to work without protection. We are giving them health advice. So this is a shift of the management from a legal mandatory isolation order to a more self-dependent health advice.
好，最後一條，呢邊第三行白色衫位男。
Gentleman in white on the 3rd row. Ming Pao Daily. Now, for designated clinics and telemedicine. What is the quota now? In absence of any telemedicine, it would be difficult for people to get a sick note, and people may be flooding the GOPCs or the A&E. Now, the Secretary, what monitoring measures should be put in place? Now, you said that Hong Kong has the hybrid immunity barrier. Do you agree with the experts who said 6 months ago that this should be the case? Aren't you worried that with these relaxation, you're going to get the people of Hong Kong killed? Right, for designated clinics, as the infection numbers are coming down, the attendance at the designated clinics or telemedicine has also come down, so it is only right for us to adjust the level of service. As I said, we should free up the capacity to look after the non-COVID patients. But in terms of the overall public health service, I must emphasize that as the COVID infection is more similar to other respiratory infections, we will focus our attention on the high-risk positive patients. And there are a number of ways whereby people can avail themselves of the services. For cases with minor symptoms or asymptomatic cases, we would encourage them to go to the private practitioners for the medical care. We have to serve the high-risk patients. We have to guarantee that they would be able to get the quota. We will massively increase the episodic quota from 7,000 to more than 10,000 per day. And I also mentioned the care booking line. There will be a quota set aside for the high-risk vulnerable patients, children, elderly people, pregnant women, and immunocompromised patients. Professor? Right, let me add a little bit for telemedicine. Under the isolation order, the hospital authority has to roll out these services to look after the people who cannot come out because of the isolation order. In terms of manpower, the hospital authority has devoted a lot of effort to make available the telemedicine. Now, for the telemedicine, the involvement of manpower would be equivalent to 3 or 4 patients that can be looked after in the GOPCs for each telemedicine case. So if a patient is unwell, if we can have face-to-face consultation, or if we can have a body checkup, it would be a more desirable situation, and we can guarantee a better quality. You mentioned the emergency state. Why do we still have to keep this level? I must emphasize that COVID is moving into a new stage. We are adopting new strategies, but it doesn't mean to say that we're giving up on any anti-pandemic efforts.
WHO still listed COVID as an event warranting international community's attention. It has also recommended testing and monitoring of new subvariants. And the WHO also emphasizes that it is important to continue with the wearing of masks and observation of personal hygiene. In fact, in the United States, they have announced that the COVID will continue to be in a state of emergency till April. Whereas in Hong Kong, we maintain the same level of emergency for COVID situation because some measures will only be effective under this state, such as the mask mandate, the government vaccination program, and testing requirements. All these measures are rolled out on the basis of COVID being a state of public health emergency. In the United States, this state will be extended until April. So it is related to testing requirements and so on and so forth. As for hybrid immunity, I must say that we have been in close communication with experts, and I have listened to the views of experts, especially on this theory. The government's direction is clear. We would like to take gradual and steady steps in tackling COVID. We don't want to backtrack. And in fact, since the start of this term of government, we have been heading in the same direction, and we are in line with the experts' advice. It's only a matter of the different strategies in terms of implementation. Now, as I mentioned just now, in the fifth wave, we have seen that our healthcare system is resilient enough to cope with the situation. And the immunity barrier led by high vaccine coverage and large numbers of infections have led to a good barrier. So these two are not in conflict. That's the end of the press conference. Thank you.